Hi, happy Friday, everybody. Dr. Amy Ostrick here with Health and Healing Direct Primary Care.
Dr. Brian, Dr. Brian Ostick, emergency medicine physician in Van Nuys, California.
Yes, the husband.
I am the husband.
Husband. Unpaid CFO, all things.
I don't get paid for
Everything.
doing any of this.
You were dispensing medications yesterday. You were doing all kinds of tasks yesterday. You were very useful and very affordable.
Thank you.
So what we want to talk about today is just a quick update on the COVID data. Right after we filmed last week, Governor Newsom announced kind of a new strategy in how they're going to categorize counties and community transmission with COVID. So we're going to briefly look at that. And then I'd like to actually take a minute to pause and focus on something that is, I think, being overlooked during this time, and people are scared to kind of come to the doctor and pushing off their preventative health visits and their well child visits or their physicals. And as we all know of, the tragic loss of Chadwick Boseman last week kind of really stirred a lot of us in thinking about, gosh, maybe there could have been, who knows, a change in the course of his illness if he had been caught earlier. Certainly, we know that the earlier stage of cancer that is caught, that it obviously have a better prognosis, and I don't know the specifics on his particular diagnosis, and he was certainly very young, but it just really puts kind of a exclamation point out there on making sure you are up to date on your health screening. And African Americans are at higher risk for developing colorectal cancer at earlier ages. So that's something that you may not know, and unless you have access to primary care and you have a good relationship with a family doc.
That makes sense.
Yeah.
So tell us about the California stuff first.
Quickly, the COVID data. So it actually is pretty simple, and it's a nice website to look at now, especially for small businesses and for certain industries. Purple, red, orange, yellow. Purple, we're in kind of the highest level of community transmission, so most things are shut down, including schools and a lot of kind of closed indoor activities. And they're now identifying those by case rate and positivity rate. So case rate greater than 7 per 100,000 on a daily 7-day rolling average, and then the positivity rate is greater than 8%. Again, that was a 7-day rolling average as well. We are in LA County, we've met the criteria from a case positivity rate to be in the red. We've been averaging between high 4s to low 5%, but we are not quite there yet with our daily case rate per 100,000. We kind of hit, for the first time for the last few days, we've been under 1,000 cases per 100,000, which is great.
So we're still in the purple.
We're still in the, less than 100,000 cases a day, which puts us almost at that case rate. We're at like 10 cases per 100,000. So we're still in the purple because you have to meet both of those markers to be shoved into the red. Once you're in that red for 2 weeks, we can talk about maybe reopening schools and doing some other indoor activities. So that's the update there.
So what's the website people should go to?
The website, what does that say? cdph.california.ca.gov. Honestly, the easiest is to Google California watch list. It'll take you to the new website. And actually, you can plug in your industry. You can see what you're allowed to do and what you're not allowed to do, which makes it, I think, easier for most people.
Okay. Well, that's good. All right, let's talk about screening.
Screenings.
Very sad to hear about Chadwick Boseman. Obviously, he had a colon cancer. And like you said, we don't know kind of what the situation was, but screening for kids, let's talk about that first.
Yeah.
What do kids need to get during this time that they've been pushing off?
Child visits are very important. I mean, number one, obviously being the vaccination protocols. We do not want to delay in these vaccine schedules. There's a reason why these schedules are the way that they are, why certain vaccines are with other vaccines and why they're at certain time periods. We don't want to wait in 6-12 months to get our kids caught up. We don't want to see a little outbreak of mumps or measles or pertussis in the spring because there's a reduction in herd immunity. That would be really devastating. So absolutely making sure your kids are up to date on your well child visits, because you don't know, these things slip by you and you're like, oh, they never got that third Hep B, or they never got that second MMR.
Right.
And then also we do growth screenings, is making sure that they're staying on track for their growth, for their stature, and for their weight.
Mm-hmm.
We talk about all kinds of things behaviorally and developmentally to make sure they're on track for those things too. Those are things we don't want to delay and miss, and make sure we are diagnosing these things timely for kids.
Vision and hearing.
And some, the AAP actually recommends maybe even a lipid screen, A1C check for certain kids at certain ages to look for metabolic disease. So absolutely making sure your kids every year are getting a well child. Even when they are done sort of more or less with their routine vaccinations, they should be getting a well child exam.
Okay. What about women? What should women be doing during this time for screening?
Right. So real quick, as far as from an age standpoint, 18 to 30, you're getting a PAP age 21 to 30, you're getting a PAP every about 3 years if they're normal. We stopped screening. We increased that age to about age 21, probably about 5 to 6 years ago. So now PAPs are at age 21. At age 30, they can be kind of spaced out to every 5 years if you're getting an HPV DNA test at the same time. So at 21, you start your PAP screening. 30, you may space it out a little bit more. At age 40, you're thinking about getting your mammography, so your breast cancer screening. It may be earlier. And the other real reason why this is an important feature is that, having access to a primary care doctor, you can tease out if maybe you're at higher risk for earlier onset cancers, or maybe you're having symptoms that are suspicious, so maybe you would qualify for an earlier screen.
Okay.
You have a first-degree relative with a history of breast cancer at a younger age, things like that. Those are things you have to talk about with your primary care doctor, and you may not know from just talking to your family members on your own.
And you do Pap smears in the office?
PAPs in the office, yep.
And that's specifically to look for cervical cancer for people who aren't aware.
Okay. Yes.
All right, what about the men? What should the men be doing these days?
So the men, also at 18, same thing, yearly physical, also to talk about lifestyle choices, modifications, lipid screening, and STD screening as well for all of our teens and in our young adults annually, ideally. And probably, then so that takes you all the way through your 20s. So I don't see a lot of men in their 20s unless there's an issue. Again, so having a good relationship with a primary care doctor so that you can check in every year to make sure that you are up to date on your screening, but also maybe there were some funky symptoms of something you had over the last year and you want to just check in and make sure that those are okay and not abnormal. Like if you had rectal bleeding and you're 31 years old or 35 years old, that's not normal. So that's not always a hemorrhoid, right? So those are reasons to check in with a primary care doctor.
Yeah, because you wouldn't routinely, just to speak about Chadwick Boseman for a second, he was 39 when he was diagnosed. You wouldn't
at stage 3.
Yeah, you wouldn't routinely check somebody who's under 40 with a colonoscopy.
Not necessarily if they were at low risk, but African Americans, like I mentioned, have a higher risk. The American Cancer Society has put a big push out there to actually get adults screened as early as age 45 for normal risk, and for higher risk, meaning you have a first-degree family relative that had a diagnosis of colorectal cancer under the age of 40, you will get screened 10 years prior to their age of diagnosis. So
what about this case? What if you had a 35-year-old male who had no family history but came in with a complaint of rectal bleeding?
Colonoscopy.
You would screen for that?
Yeah,
okay.
Absolutely. Well, it's diagnosis at that point because you're now concerned and suspicious that there's something else going on.
Okay.
So absolutely. So that's again a reason why young healthy males have that kind of invincible feeling that there's not a whole lot but to talk about or to go that they need to do, but there's probably something that you're missing with your risk factors. So teasing that out and fleshing that out with your primary doctor is important.
That's really important. That's good.
Age 40, prostate cancer screening.
That's where I was going. The men on this that are watching this are going to say, I'm putting this off because I don't want to get the rectal exam.
The digital rectal exam. If that's the only reason why you're not coming to see a primary care doctor, you're really doing yourself a disservice. The digital rectal exam is imperfect. It's not great at screening out prostate cancers. It's kind of and so if that really is your fear, at least discuss that with your primary care doctor. You can at least start with a PSA test, which is a tumor marker for prostate cancer. But having that discussion with your primary doctor is really important. It's imperfect, the PSA, but it's sort of all we have. So having that shared decision, making that discussion, but certainly the digital rectal exam is not a reason to not go. It's not a great test, and I don't even do them all the time for screening. I do them more if there are actual symptoms and we need to diagnose something. But for screening, they've really been proven to not be very helpful.
Okay.
But PSAs do. So 40, you start thinking of prostate cancer. Again, for men and women age 50s, when you have to start thinking about colorectal cancer screening, and maybe even age 45. There's been a big push again from the ACS.
The ACS is the
American Cancer Society. And then the other big one is lung cancer. So lung cancer screening, if you have a history of smoking, you need to talk to your primary care doctor if you qualify for a CT chest, because that's a new guideline as well.
Okay.
There's been a lot of research poured into making sure that the risk of the radiation of that CT is low enough, right, to warrant to potentially catch an earlier lung cancer diagnosis. So these tests, these screenings save lives, because we find something on that CT at an earlier stage and can treat it and potentially cure that cancer, versus 5-10 years later when you're having somatic physical symptoms of metastatic disease, and that would be a tragedy. So
okay. And lastly, you could do skin checks for weird looking moles or skin lesions that you think might be cancerous.
Yeah, annual skin checks, especially for all my patients that that have a history of living in California. So
yeah, we got a lot of sun.
Got a lot of sun, and yeah, annual skin checks with your primary doctor, absolutely, for that too.
All right, thanks, Dr. Ostick.
That was a lot of info.
Lastly, whichever secret admirer sent me these beautiful flowers, please reach out.
They weren't for you. They were for me and Anna Maria.
Oh, I thought it was.
And it wasn't you that sent them. No? Or are you going to take credit for it?
It wasn't me, but I will take credit.
Thank you so much to whoever sent these. We really appreciate it. We celebrated our 1-year anniversary, and we're so happy to be here to serve our community. Please reach out if you have any questions, 818-600-2426. Look us up, check us up at the website, www.healthandhealingdpc.com. Thank you, Dr. Ostick, for
Thanks. Smash that like button, subscribe down below, comment, and share this with your friends.
Thanks.
Thanks, Dr. Ostick.
Bye.